Now I'd like to introduce the chairman himself, Michigan Congressman John Conyers.
Thank you, ladies and gentlemen, brothers and sisters. Having just left the first healthcare summit ever called by a president of the United States, I'm going back Monday and recommend immediately that President Obama do the same thing that your governor has done and put Quentin Young on the National Committee for Health Care. And from the tone of that summit, they need you. We need you in that summit. I only want to say that we have the responsibilities to be the Frederick Douglass that was for Abraham Lincoln. We have to be that for Barack Obama. We've got to remember that health care and universal health care and single-payer health care was something that we were working on advocating for even before Barack Obama picked it up when he was an Illinois elected official. And now the pressures are so enormous. In that White House summit meeting, there was the corporate health representatives of the country there. Yes, the pharma was there, the insurance companies were there, the HMOs were there, the for-profits were there, and there were a lot of us, but Jan Schakowsky was there. Now, Jan couldn't contain herself. She said, "John, say something. Why don't you?" But you see, we were playing good cop and bad cop that day, Jan. And I had the privilege of knowing what it feels like to be the 600-pound elephant in the room. Everybody, and you know, I didn't even have to say anything because they knew why they didn't want Conyers at that summit. Because he and Danny Davis and Jan Schakowsky and Bobby Rush all are on the biggest, most numerous universal single-payer health care bill in the country. Last year we had 91 co-sponsors, more than any other bill in the Congress. That's why they didn't want me there. Now, not being a thin-skinned, sensitive member of the legislative body, I understand that. And they understand it too. And so we're caught with this immediate consideration. Here's a president that in the course of 3 weeks has inherited more problems than any other president has faced in the 20th century. And so we understand that there is a great tendency to say, well, let's get something done. There's so many things wrong with this system that you patch it up a little bit and claim a major victory. Well, there's one thing I've been in longer than this brilliant, wonderful 44th president, longer than, and this isn't going to be compromised or patched up. We want the real McCoy in healthcare, and we're going to get it. I just left. We came in from Philadelphia. Governor Rendell there has told his legislature that if they pass that bill for single payer in Pennsylvania, he'll sign the bill. Jennifer Granholm in Michigan is going to say the same thing when we get through with a little talk with her. And so we're on the move, folks. This is something that can't wait. It's time sensitive, but you've got to do it right. I love all these, and I conclude with this, I love all these discussions about, well, let's put public and private, and we'll have people make a choice, and it'll be affordable insurance. Damn it, you can't have affordable health insurance. You need a right to health care. If you don't have any income, how can you have affordable insurance? It's a non sequitur. It doesn't make sense. And that's why I'm here, because Quentin Young taught me to understand that there are some time that you have to fight and instruct even your best friends. And I salute you, Quentin, for not just what you've done in your state and country, but the international concept, the global notion that we can create a better world through creating our own examples is something that can apply in the Middle East and Afghanistan, and certainly in this important issue that brings us all here to celebrate our international leader, Quentin Young. Thank you very much.